Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm delighted to have as my guest Dr. Rani Banik, who is a medical physician, board certified in ophthalmology with fellowship training in neuro-ophthalmology. She has been featured as the in-house ophthalmologist in a lot of places, Good Morning America, the CBS Evening News. She's been cited by her own peers as a top doc in 2017, 18, and 19. And she's also the author of two books. One is Beyond Carrots, the best nutrition for eye health, A to Z, and Dr. Rani's Banik's visionary cookbook. So welcome, Dr. Banik. It's so nice to meet you. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Thank you so much, Dr. Sabatino, for that very kind introduction. It's a pleasure to be here. I'm really excited.
Yeah, I think the first thing I always like to know with docs is that what were some of the aha moments that moved you into kind of understanding and feeling that plant-based nutrition became an important thing in your life personally and professionally?
Yeah, so it was in my adulthood, I developed a health issue of my own, and it was quite challenging to manage. And I stumbled upon the benefits of proper nutrition, mainly plant-based nutrition. And that's really what turned my health around. So to give you some more details, I'd had migraines since I was in my early 20s. And it was just very sporadic. It wasn't very common at all. But then once I get into my early 40s, I had a lot of stressors in my life, and my migraine just became not just chronic, but daily attacks. And if you've ever experienced a migraine, you know that is not enjoyable at all to have a migraine. But imagine having that every single day, stabbing, sharp pains in my head, light sensitivity, brain fog. It was very difficult to function. And I knew I had to find a solution. So initially, I saw some of the top doctors in New York City, headache doctors, who gave me prescription after prescription after prescription, and nothing was working. And finally, I said, you know what, I have to take things into my own hands. And I started to do research. And I realized that there is quite a bit of published research about supplements, but also diet when it comes to migraine. And meanwhile, I cringed to think what I was eating at the time. I was having the worst diet possible. I was having every day ice cream, pizza, and diet soda. That was my diet. And when I realized, okay, I need to make some changes in my life to really help myself get out of this migraine cycle, when I made those changes, I cut out the dairy, I cut out a lot of gluten, I cut out basically most of the animal products I was having and processed foods. That's when my health started to change and turn around. And it was really eye-opening, pun intended, for me to go through that struggle and to realize the power of food.
Yeah, so you were already a kind of a practicing physician when you came to these realizations about nutrition, and you, as you said, what was the stuff that promoted that? Is there stuff that you read? Did you see any? Did you go to lectures? Was it your own private research? What led to that?
It started off with my own research into some of the supplements that can be beneficial for migraine, for example, magnesium, riboflavin. And I thought to myself, well, how come none of my doctors ever mention any of this to me? So I said, there must be more. And then as I did more and more research, I realized there is a lot more. And much of it is based in nutrition and plant-based nutrition. And so it really opened my eyes to the many things I could have been doing all those years when I was suffering from migraine. So I'm actually quite fortunate. I feel fortunate that I went through that health struggle, because it opened my eyes to a whole new aspect of medicine that I was never taught in medical school. I think most of us as physicians, we weren't really properly taught nutrition. So I'm glad I went through that. And you had asked, did I do any special training certifications? So yes, I actually ended up, I was so taken with this whole approach of using food as medicine that I ended up getting certified in integrative and functional medicine. And this is really the foundation of what I use now for the care of many of my patients. So
So
it not only impacted my own health, but now I'm able to use
yes,
this
you're bringing it into the world in a very positive way, which is so important. So let me ask you the question: why ophthalmology? What was the drive? What was the passion for that?
So back when I was actually in college, as a senior in college, I was shadowing different doctors. I knew I was going to go into medicine, so I didn't know what field though. So I was shadowing different doctors, and I happened to shadow a family friend who was doing his ophthalmology residency. And before that, I was never really interested in eyes, but he really took me for the day into the operating room, into the clinics, and I saw the incredible impact of what he was doing on patients' lives. He was able to restore vision by taking out someone's cataract, give them back their functionality, allow them to be able to read and drive and do many of the daily things we all take for granted. I saw him operate on children who had strabismus, basically crossed eyes, and be able to fix that. And I just fell in love with ophthalmology that day. And I realized that our eyes are so precious, but we don't really think much about them. We oftentimes just take them for granted. But when we lose our sight, it can be so debilitating. And I wanted to be able to have the skills to help people regain their vision and really have that deep, meaningful impact on someone's life.
So
And yeah.
so how much of your practice is involved with those kinds of surgical interventions or those interventional approaches? Is that a big part of what you do?
So I've
Cataract
moved a lot.
cataract removal
It
and that
used
kind of
to
thing? Yeah.
be, yes, it used to be. And then once I discovered, preventative eye care, functional medicine, I would say that the procedural aspect has now been cut down to about 25% of what I do. And the rest is a lot more counseling. Um, Again, preventative care when it comes to nutrition and also lifestyle modifications.
Yeah, so let's take a look at a couple of things that people do generally develop quite readily that are common in the culture that you hear a lot more about. And let's get your take on and what the person, I mean, I realize it's individual and you're going to create
Mhm.
personalized programs for people, but generally speaking, let's talk about cataracts and something like macular degeneration, which are very common things that, especially with macular degeneration, it kind of strikes fear in the hearts of people. They just feel like there's no potential for recovery. There's nothing they can do. And as you know, a lot of physicians with these problems, they're just really disease managers. They're not really taking the functional approach that you do. So talk a little bit about that for our audiences. I think they
Yeah,
would
so
be
the
interested.
two conditions you mentioned, cataracts and macular degeneration, these are two leading causes of vision loss in the world, in both the developed world as well as developing nations. The thing is, both of these conditions are slow in their progress. It's not that they happen overnight. And there is so much we can do for prevention to prevent it from getting to an advanced stage where it actually impacts vision. So we can start with macular degeneration. What happens is, first of all, there are two types, two general types, which is dry and wet. And in dry macular degeneration, what happens is there are changes in the back of the eye in the macula, which is responsible for our 20/20 vision, and there are waste deposits that accumulate underneath the retina. And eventually these waste deposits, they grow in size and number, and they cause inflammation, and they cause new blood vessels to form. And these blood vessels, they're not normal blood vessels, they're abnormal. They tend to leak. And when they leak, that's when the condition switches from dry macular degeneration into wet macular degeneration. And by that point, if they've already leaked, people have had significant vision loss. They've lost a lot of their central vision,
Right.
where they can't see faces, they can't read, they can't drive, they can't work, use devices. So it can be really debilitating. But the time frame in which one goes from dry early stage macular degeneration to late end stage wet macular degeneration, again, it is not overnight. It's not even months. It takes years or even
Right.
decades, which means that there is a time frame in which we can intervene. And the best way to intervene is through diet. Now, many people may have heard of some of these nutrients that are so important for the macula, for macular health. They're called lutein and zeaxanthin. These are two of our most important nutrients. I call them eye vitamins, even though officially they're not vitamins. They are so important for macular health. And studies have shown that if individuals have enough of these two nutrients in their diet, again, lutein and zeaxanthin, that they can slow the progression of macular degeneration, slow the progression to wet macular degeneration. So if that's the case, we can decrease our risk for macular degeneration by over 40% simply by diet alone. So why is it that more doctors are not talking about this? Because we're not taught. That's the bottom line. And
Right.
even when I was training in my residency, in my fellowship, no one ever told me, why don't you just use this as a primary intervention before anyone even develops advanced stages. Use this preventatively for people who may simply have macular degeneration in their family. They may not necessarily have any signs yet, but that may help them prevent the progression of this disease. So I think that's really my mission, is to get this information out there that people can take proactive steps starting now before they even have problems to worry about. They can increase their dietary intake of lutein and zeaxanthin. They can moderate their weight. They can start to do a little bit of movement exercise. They can stop smoking, limit their exposure to chemicals, fumes. All of these interventions that are under people's control can help decrease their risk of macular degeneration. So there's a lot we can do.
Right. Do you feel that a broad, diverse, plant-exclusive diet will provide enough of those nutrients, or do you feel that they need to be additionally added in supplementation? What's your feeling about that?
They can. So a broad plant-based diet can. And so I'll give you some numbers. So in terms of prevention of macular degeneration, it's recommended that we have at least 6.5 milligrams of lutein a day. Anywhere from actually 6.5 up until 20 milligrams of lutein a day. Most individuals, especially those in a Western style diet, have only 1 or 2 milligrams a day. So yes, you can boost your intake simply by eating plant-based foods like leafy greens, for example. It's a perfect example. If you're having, let's say, 3 to 5 cups of kale a day, you're getting that daily requirement. You don't
Right.
necessarily need to take a supplement. Or if you're eating any leafy greens, so spinach, collard greens, Swiss chard, these are all amazing sources of lutein and zeaxanthin. Also, yellow and orange foods. For example, many people, when they eat bell peppers, they choose green bell peppers, maybe because they're most available. But actually, it's the orange and yellow varieties that have the highest concentration of lutein and zeaxanthin. So choose color, choose bright orange and yellow colors. Also, corn. Corn is another great example of a food that can provide us with lutein, zeaxanthin. And interestingly, the scientific name for corn is zea mays, and that's actually where zeaxanthin got its name from zea mays of corn. So
Interesting. Beautiful. I always tell people they don't need to be a biochemist. They just need to put a rainbow on their plate, basically. And that's what we're looking at, that colorful
exactly.
array of things. I'm here with Dr. Rani Banik, who's a board certified ophthalmologist. We're going to take just a short break to hear from our sponsor, the National Health Association, and we'll be right back. You're listening to the NHA Health Science Podcast. Dr. Sabatino here, your guide to a healthier lifestyle. Are you ready to embark on a culinary adventure that's both delicious and nutritious? Look no further than the National Health Association's website. Go to healthscience.org/recipes. There, you'll discover a treasure trove of mouth-watering plant-exclusive recipes. Whether you're a seasoned chef or just starting your culinary journey, our collection caters to every skill level and palate. Try out these delicious, delightful recipes, experiment with flavors, and don't forget to share your creations with us. Visit healthscience.org/recipes today and transform your meals into delightful, health-packed experiences. I'm Dr. Frank Sabatino, your host, and now back to the NHA Health Science Podcast, where more exciting insights await you. Welcome back to the Health Science Podcast. My special guest is Dr. Rani Banik, and we're going to go next into cataract formation. Let's talk about that just a little bit.
Yeah, so cataracts are a natural part of the aging process. And it's what happens when the lens inside the eye, we have a natural lens inside the eye that's normally clear, transparent when we're younger. As we get older, the lens goes through oxidative stress. So changes that happen with age, also changes that can happen from too much sun exposure, UV exposure, for example, can lead to oxidative damage. Eventually, the lens, from all of this oxidative stress and damage, starts to become a little bit opaque. It starts to become yellowish in color and eventually brown in color. So this is, again, part of the natural aging process, but we can slow it down. We can retard it by having enough antioxidants in our diet. And the best place you can get antioxidants is from plants. So plants naturally make antioxidants to protect themselves. So when we ingest plants, we get those benefits conferred to us into our bodies, into our eyes. So there are studies to show that populations that have a rich plant-based diet have reduced risks of age-related vision changes, including cataracts. And of course, in addition to that, you also want to be proactive about sun exposure. So I always tell my patients, make sure when you're going outside, even if it's a cloudy day sometimes, if it's during the hours, between the hours of 10 a.m. to 2 p.m., always be sure to wear your sun protection. So wear some nice big sunglasses that will really wrap around and protect your eyes. Make sure that they have a sticker that says 100% UVA, UVB blocking, because unless it has that sticker, there's no guarantee that those lenses are filtering out those UV rays properly. So look for that sticker. It doesn't matter how much the glasses cost. It could cost $10. It could cost $300. It doesn't really matter. Just look for that sticker on your glasses.
Rani, does that pan out with data related to Sunbelt states? Do we see more prevalence of these problems? Is that something that shows up in the data? Like if you're comparing Florida to New Jersey or New York, where you're exposed to sun much more prevalently, do we see that in the data that it supports what you just said?
So I'm not sure if there have been any studies looking at cataract formation, but there have been studies looking at glaucoma, which
Right.
is another age-related eye condition. And it's actually interesting. People who are at higher northern latitudes tend to actually have a higher risk of glaucoma. And it's thought to be because of the angle of the incoming rays, not just directly, but coming in from the sides, which can damage the drainage structures of the eye, which is called the trabecular meshwork. So that I'm aware of. I'm actually not yet, I haven't heard of anything when it comes to cataract formation in the Sun Belt, but perhaps.
Let's talk about your passion. You got this nice practice in the Upper East Side and vision. Tell me about what and how you participate in that practice, because I know that you do a lot of very personalized things with your people. So let's let the audience know. Someone comes into you in your practice. Take us through the steps that you would do as a functional medical doc to address the kinds of issues that they may present to you.
Absolutely. So first of all, it's not your standard 10 to 15-minute appointment with your eye doctor that I provide. It's a very comprehensive, in-depth exploration of eye health. So I tell my patients, block out at least 3 hours of your day. Don't expect to be in and out. It will take at least 3 hours. So I do a very complete intake, their medical history, family history, diet history, social history. And then, of course, I do the full eye exam. And I actually, on all of my patients, I do a full neuro-ophthalmic exam. So not just a regular eye exam, but the entire neuro-ophthalmic exam, which includes checking for glaucoma, which includes checking peripheral vision, visual fields, color
Right.
vision testing, depth perception testing, and of course, a mandatory dilated eye exam. I know a lot of patients they don't like to have their eyes dilated because the drops make their pupils large. They can't see for a few hours. They're light sensitive, but a dilated exam is a must because through that dilated exam, we can pick up so many medical conditions, ranging from high blood pressure to diabetes to cancers of the eye and even autoimmune diseases of the eye. So that dilation is important. And then this is, I think, the most important. I do order blood tests looking for various different vitamin levels, inflammatory markers, sometimes autoimmune markers, and then in a kind of the second part of the visit, I go through a very detailed personalized diet plan based off of what I've seen. But I also tell my patients we still have to wait for your labs to come back before I can give you my final recommendations. But we get started at that very first visit talking about diet. And sometimes I do recommend what I call therapeutic diets for eye health. There are very specific nutrients that I really encourage, for example, specific nutrients for dry eye or for glaucoma or macular degeneration based off of the scientific evidence that's published. So again, this in its entirety, it takes about 3 hours or so. And of course, then there are follow-ups to make sure patients are understanding, what they need to do and following up with the recommendations. Sometimes, now not always, but sometimes if I do feel there are dietary gaps, I do recommend supplements. But again, it's not a one size fits all scenario. It really is very individualized to the patient.
Right. And I notice also that you handle some other pillars of functional medicine because, as you know, eye health can be affected by stress. It could be affected by other conditions of that kind. So I saw in your paperwork that you incorporate that, I guess, over time with your people. If you're seeing that it's something where their stressors are contributing to the outcome or whatever else may be coming up for them, you address that in your practice too.
Yes, and it's important to remember that the eyes, even though we may think of them as isolated organs, they're really intimately connected with so many other organ systems in the body. So it is important to think about our eye health very holistically. And I would say two things that really are most important: gut health, number one. And some functional medicine doctors say that it all comes back to the gut. Everything starts from the gut, but there is a lot of emerging data that shows that gut dysbiosis, or when there's a gut microbiome that's not healthy, that can negatively impact eye health. It may increase the risk for dry eye or uveitis, which is a type of inflammation inside the eye, glaucoma, and macular degeneration. So I definitely talk to my patients about their gut health and make certain recommendations to help them optimize their gut health. The second thing that I really stress to them is stress. Actually, we all have stressors in our lives, and it's a matter of managing those stressors. I've seen countless patients where their eye issue was triggered or exacerbated by severe periods of stress in their lives. One perfect example is optic neuritis. Now, optic neuritis is inflammation of the optic nerve. It can happen in isolation. Sometimes it can be the first warning sign of multiple sclerosis or another type of autoimmune condition. But so many of my patients, when I ask them, what's going on in your life, what's happening, that may have been associated with this optic neuritis, this eye inflammation, many times they'll say, I've been really, really stressed, whether it's coming from work or from home or some other health situation. Stress is the underlying elephant in the room. And so I definitely talk to my patients about ways that can modulate their stress, whether it's listening to music that they enjoy, or maybe spending time with loved ones, or going for a walk, being out in nature. These are definitely aspects of health that need to be promoted and addressed. And I think as physicians, it's one of our obligations to explore these avenues. What's going on with the patients, their whole entire mental state, their psychological state, and how can we help them support that?
Well, there's two things that come to mind. When we look at gut health, because you brought it up, we know that when you're eating a diversity of plants, you have the healthiest diversity of gut flora too. And when you're not eating refined processed foods, you're creating a little bit more of an endotoxic state. You're favoring organisms that are more endotoxic. And what's intriguing is that when that damages that lining of the gut and those toxins get into the system, I saw some data that suggested that it could even damage blood-brain barrier, so they can actually get into the brain environment, which could eventually get into the eye environment. So it's kind of intriguing, that connection, because I love the gut-eye, gut-brain connection is so interesting to me all across the board.
Yeah,
And
I
the other,
actually just did some videos for YouTube on the gut eye connection because
oh,
I
you
think
did.
it's not well recognized. A lot of people understand, oh, there's a gut brain connection, there's a gut immune system connection, there's a gut heart connection, but the gut eye connection again is something that people may not never have heard of. Even many ophthalmologists, optometrists, my colleagues have never really associated gut health with eye health. But just to speak to what you were alluding to earlier. The lining of the gut, when it breaks down because of particles that are not supposed to be there, they can get into the bloodstream and then eventually help to break down the barrier in the eye. There's something called the blood retinal barrier. And when that breaks down, it can lead to types of inflammation in the eye,
Right.
specifically uveitis, which I was mentioning earlier. And we also know that there are certain bacteria in the gut, certain what we call pathogenic bacteria in the gut, such as Campylobacter or Shigella or Yersinia. These specific microorganisms that are not healthy gut bacteria can actually trigger inflammation in the eye, uveitis. So there are studies, many, many studies to show that. So it is really, really important to promote gut health when you're thinking about your vision.
Yeah, let me run something else by you, see what you feel about this. One of the things that the NHA advocates is not only plant exclusive, but without added salt, oil, and sugar. And some of the data on salt exposure, the excessive amounts of sodium and salt that are consumed in the American diet, can have a direct effect on damaging the endothelial glycocalyx that
Mhm.
protects the inner barrier of these blood vessel walls, and especially in capillary beds could actually lead to retinal bleeds. Do you feel that there's an accuracy to that? Do you feel that that can be an important contribution to some of that petechial retinal bleeding that could now create issues with macular change and other things of that nature? What do you feel about that?
Yeah. So the instances in which I've seen that happen is when the high salt intake leads to hypertension. And then hypertension in turn causes something we call hypertensive retinopathy, where there are hemorrhages in the back of the eye. There are microaneurysms that
Right.
can bleed, macroaneurysms that can bleed, strokes to the back of the eye, retinal vein strokes or retinal arterial strokes associated with hypertension. So that's an interesting concept. I'm going to look into that, but to my knowledge, I don't know if that's ever been studied, whether high salt intake can directly damage retinal blood vessels.
Well,
But
it directly damages the glycocalyx. And so in those small capillary beds, the permeability can be remarkably affected by that damage. Plus the fact that when that endocalyx is damaged, it interferes with the endothelial conversion into
Mhm,
nitric oxide. So there's
mhm.
constriction of vessels too. So it's kind of intriguing. I'm just curious to see how much that could affect those small vessels going into the retina, which would be kind of an interesting kind of study in itself.
Yeah,
Randy,
and the eye is actually such an easy organ to study because we can actually see the anatomy simply by looking in. It's one of the few organs where you can just look in, do an
right.
exam, and see the pathology that's going on. So
Yeah, Randy, well, before we go any further, let's let people know where they can find you, learn more about your work, seek you out if they wanted to. What's the location, the URL you want them to use?
sure, my website is the best way to find out about my work. So it's www.drranibanik.com.
Perfect, 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 perfect. Let's talk a little bit about some of the neuro-ophthalmic things that you work with too, because these are other things that people are well aware of. Things like the impact of stroke on the eye, the impact of concussion on the eye, the impact of the computer syndromes on the eye. Talk a little bit about those things and the kind of the relationship of the neural eye connection that's involved in that.
Yeah, absolutely. So here's a fun fact. The eye is actually a direct extension of the brain. So during embryonic development, there's an optic cup that comes out from the brain, and that's what develops into the eye structure. So, because the eye is part of the central nervous system, there are many neurologic conditions that can impact vision. So, you mentioned a few of them: concussion, stroke, brain stroke. There's also eye stroke, but we're talking about brain stroke that can lead to vision loss. Also, things like Alzheimer's disease, Parkinson's disease, multiple sclerosis, which I mentioned earlier, and even some other types of neurologic conditions such as myasthenia gravis. Now, myasthenia gravis is an autoimmune condition. It can cause weakness of muscles, skeletal muscles, and there are muscles that move our eyes, so it can cause weakness of those muscles, leading to double vision or even droopy eyelids. So that's all of those conditions are under the purview of neuro-ophthalmology. And so it's really a wide range of different types of conditions that we treat in my specialty. But here's another fun fact: over 50% of the brain is dedicated to our visual pathways. So our vision is so complex, how we perceive not just resolution, but movement and color and form. And there are, again, so many visual association pathways in the brain, and also how we move our eyes and how our eyes connect with our vestibular system. So again, 50% of the brain is dedicated to vision. And that's why so many different neurologic conditions can express themselves with vision problems.
Yeah, let me run something else by because this is something people have been connected to over a long period. Way back when Bates wrote Better Eyesight Without Glasses, and then Dr. Agarwal in India wrote the Yoga of Perfect Sight, and Aldous Huxley. They all promoted that, that eye revisualization training. You mentioned the small muscles that attach to the eyeball that can cause changes in diffraction of how the eye would work. Do you feel that those exercises and those plans have value for changing errors of diffraction? What do you feel about that?
So Dr. Bates actually worked in the hospital where I am affiliated with. So New York Eye and Ear Infirmary of Mount Sinai. This was over 80 years ago, I believed. He was doing his
Right, right,
experiments
right,
there. So when I came across his book, I actually approached it with an open mind. And I said, I really don't know much about these eye exercises, but I will try them because I myself have myopia. And I'm curious to see if it's going to help me or not.
right,
And so I read his book. I was fascinated. I was intrigued. I tried some of the exercises, and personally, anecdotally, they didn't work for me. Okay.
right.
But that's not to say that they may not work for other people.
Well, because they have actually worked for other people quite.
They have, yes. So, this is an N of one. It didn't work for
Right,
me. But what I tell people is you can try them. Give it
right,
give it a try. Try it for at least 3 to 6 months. And if it helps you, wonderful. If it doesn't help you, look for something else. That's what I
right,
usually tell my patients. And the other thing I'll just say to you, I'll just mention, you were asking about the muscles and refraction.
right,
Many people may actually, if they received a glasses prescription or contact lens prescription when they were young in childhood, it's possible that they may have been over minused. And
right.
so if you're over minused in childhood, when you get to be an adult, your vision will actually suffer. You won't see clearly. So it's important to get something called a cycloplegic refraction. And that's what a lot of people don't realize. When you get your go for your glasses check, ask for a cycloplegic refraction because that will tell you your true underlying base prescription. So I'll tell you, when I was younger, when I was a child, I got tested for glasses, I got a refraction. They found me to be a -5 in one eye and a -3 in the other eye. And I wore that prescription for years. Even after I became an ophthalmologist, I still wore that prescription. And then I realized in my early 40s that prescription wasn't working for me anymore. So I went and got a cycloplegic refraction. And this is embarrassing to say, I was already an ophthalmologist for many years before I realized I had been over minused. My true prescription was actually a -350 and a -175. So
Wow, that's a
all
big
of those
difference. Yeah.
years, I was over minus, and I didn't know because I never had a true cycloplegic refraction until I was in my 40s.
Rani, spell that for people because to make sense out of that word, spell it for them. That refraction.
Cycloplegic, so Cycloplegic. And
And
what it
then,
is basically drops are put into the eyes, the same drops that are used for dilation, but they paralyze your eye muscle so that you can't focus through when somebody's checking your refraction. So
I
really
see.
it gives you your base foundational refraction.
So
It is so
you couldn't measure that without that little paralytic effect, basically.
You cannot measure it
Right.
properly without that. And so I always recommend, especially for children, they must have a cycloplegic refraction
Okay.
because otherwise it's very easy that their refraction can be overestimated.
You're an ophthalmologist. Would regular optometrists do that or not really?
You have to ask for it.
Yeah, you have
You
to.
must ask for it because usually they'll just do any eye doctor will just try to do a quick refraction and say, okay, this is it. Here's your prescription, but you have to specifically ask for it.
So, Rani, I know also one of your duties is that you're involved as an assistant professor. Are you teaching ophthalmology? Is that what you teach?
I am. So I was actually in academics 100% of the time until I discovered functional medicine. So now that I have my private practice, I still maintain my academic appointment. So I work at the hospital 1 to 2 days a week, and I teach residents there. So we have a full neuro-ophthalmology clinic. We see a whole range of cases from the simple to the complex. I
Wow.
love teaching. I teach residents, fellows, medical students. And then I also, at the hospital, I still run their clinical trials in neuro-ophthalmology. So
Yeah.
that's still one of my duties. And I really enjoy it because being on the cutting edge and helping people discover or, helping to bring, to the world FDA approved therapies is really an important part of my.
I read that there's about 5 of those ongoing that you're involved in, is what I read. Is there more than that?
So some of those that were ongoing may have completed by now. So
I see.
currently there are 2 that are ongoing, and then there's 2 more that we're about to begin probably in the next month or two.
What are they examining? What are they trying to find out, Rani?
So one study is on something called thyroid eye disease, in
Okay.
which people may have either Graves' disease or Hashimoto's, and they have bulging of their eyes.
Yeah,
They have a lot of
ex-ophthalmos. Yeah, okay,
inflammation.
right.
And there's actually a lot of television ads for various treatments for thyroid eye disease, but this is a new medication that we're going to be doing a clinical trial for thyroid eye disease. Another clinical trial I'm running or that will be starting soon is one for a rare hereditary type of optic neuropathy in which we're using gene therapy. Now it's fascinating, again, cutting edge, where there's a certain genetic mutant, I should say mutant, but a genetic defect that leads to vision loss in one's 20s or 30s, which can be really devastating. But with the treatment, we're actually doing an injection of the correct type of gene into the eye to see if that gene will be taken up by the retinal cells and then be able to process light better and not to have dysfunction. So
You're involved in those trials.
yes, I'm the principal investigator at New York Eye and Ear for those trials in neuro-ophthalmology.
So what's on the horizon for you? I know you want to do these trials and this research. What else is going on for you? What do you see down the road for you?
So I really want to get this information out there about nutrition and lifestyle for eye health, not just to patients, but to a wider audience. I can only see so many patients one-on-one in my practice,
Right.
but I would love to educate en masse. So I'm planning to do a summit coming up soon on eye health, where anyone can join for free. It's a week-long summit where people will hear from not just me, but other experts in eye health to learn about the best things they can do for things like diabetes or high blood pressure or macular degeneration or dry eye. And then also I plan to write more books. I actually have 9 more book ideas in me, so stay tuned for more books coming out. And I also want to educate my colleagues. So I'm planning to do a lot more courses at ophthalmology and optometry conferences. I actually have one coming up pretty soon where I'm going to be speaking to 400 optometrists from the state of Washington. So I'm
That's
really
great.
excited to be able to educate my peers in this as well.
So Rani, as we wind this down, do you have any final words you'd like to share with the audience out here? Something that you'd like to share with them?
Absolutely. So first of all, vision is precious. Don't take it for granted. You should be proactive about it. And there are many, many, many things you can do, despite what you may think that, oh, it's beyond my control. I'm going to have vision problems as I get older. That is not true. There is so much that is within your hands, that's within your control, that you can do to ward off vision loss.
Well, I can't thank you enough. I can't thank my guest, Dr. Rani Banik, enough today for sharing her expertise and sharing so much beautiful and important information, and emphasizing the importance of plant-focused nutrition for really helping eyes, which a lot of times people don't even think about. I urge you to follow her. You can see her URL scrolling across the screen if you want to hook up with her or visit her or make appointments with her. And I want to thank the audience out there that joined us today, because without you, we can't do what we do. And I want to thank you for being part of this very active, healthy community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I look forward to being with you on the next episode of the Health Science Podcast. Dr. Banik, thank you so much. We really appreciate it.
Thank you, Dr. Sabatino.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.